Hello and welcome to Bariatric. I'm so excited to continue this December's podcast and video series on the gifts of bariatric surgery. And not just the gifts that the person who's had the surgery experiences when they choose to make this lifestyle change, but also how the other people in their lives share those gifts with them. And tonight I have an amazing woman. Um, I have known her for about a year, but she is so incredible, and I am just so drawn to her energy and her spirit and all the good things she has been doing that I wanted to share her with you because she is a gift to anybody who knows her. I
Mhm.
guarantee it. So let me introduce to you Ilona. Hi, Ilona.
Hi,
How
Connie.
you doing?
I'm great. How are you?
Good. I really appreciate you doing this with me tonight.
Thank you for having me.
Yeah. Okay. So when did this whole thing start for you? This whole idea about having surgery to begin with?
Well, let me say it's ironic that I'm speaking to you today because tomorrow is my 1 year anniversary from
Oh,
surgery.
wow.
Yes.
How about that? So
Yes. So
surgery number one. Wow,
yeah,
your life has changed in
tremendously.
so many ways. All
Tremendously.
right. I'm anxious to hear all about this. So
Yeah,
how did it start?
I can't believe that it's been a year. It in so many ways it's just breezed by, but it's been a journey, and I know that this is a continuing journey. So um one thing about it is it changes from day to day. So
Yes, for sure.
it's a roller coaster. So you have to be prepared.
And
So
I love that. That's the reality, right?
yes,
You know,
absolutely.
it's the before and after pictures are so enticing and
Hmm.
so like that is what I want, and I want to go in the front door of the office and out the back door with
Hmm.
that body. But
Hmm.
that's not the reality.
It's not. It's and it's funny that you don't really understand it until you go through it.
Yeah.
You can, and I think that's why it's been important for me to say, just speak when I can, because it's not an easy journey at all. Um, Even making up my mind to do it, it was years. Um, I toyed
Really?
with it. It was years. I toyed with it, but I was really scared. I was really spooked out by it. Um, and I had a friend tell me, "When you're ready, you'll do it. If you get ready." And
So were you spooked by the idea of having a surgery, or what were the things kind of holding you back for however long it was?
so part of it was just the surgical portion of it. That was definitely a fear. I think also was just the unknown. And also, you can kind of hype yourself up if you go into, if you listen to other people's stories, and then you hear, it's funny because only the bad is what rings out. And then you hear
Mm,
all these, horror stories, or they may not even be horror stories, but they sound like it at the time. And it
hmm.
just kind of makes you say, I don't want to go through that. You start thinking about, stuff like, oh, I'm going to lose all my hair, or,
Yeah.
my skin's going to be hanging to my feet, or, I'm not going to be able to eat without being sick. And what's ironic is you start getting scared about all of those things, but then you don't think about the things that you're actually going through that should actually be scaring you as well.
Which is?
Well, at the time, I was battling very high blood pressure. At
Oh,
one point, my cardiologist had me on a pill that would bring my blood pressure down immediately within like 10 minutes, because it was just getting that bad. And so I was
mm,
dealing with that. I was dealing with sleep apnea, and several issues, but you get comfortable with that.
yeah.
So it's the unknown issues that scare
Yeah. You're right, though, and I really want to bring attention to sleep apnea for just a minute.
you.
Not that that blood pressure wasn't terrifying,
Yeah.
and I've
Mhm.
also had a life-altering change because I ignored the fact that I had high blood pressure. I say ignore, I didn't know I had high blood pressure, but I ignored the symptoms
Yeah.
anyway. Um, when you talk about sleep apnea, so many people hate that mask or hate the apparatus that they have to sleep with, but sleep apnea is one dangerous disease,
I
and
had
people die from that.
I had it undiagnosed for years. By the time
Hmm.
I went and did my sleep study, I was waking up 90 times a minute.
My
And he said he
gosh.
didn't even know how I was walking around and surviving. I was going to sleep at red lights. I was just
Oh
going
my
to sleep
God.
at just random places. And I couldn't figure out what was going on. So for me, when it was diagnosed, I slept with the mask on. It was like a whole different sleep. I was great. I slept with
Yeah.
my mask literally every night. Um,
Yeah.
but just because I was finally getting sleep, but that takes a toll on your body. Not
Sure
getting the sleep
does.
that you need. So,
And of
um,
course, Matt, everybody knows this. I'm sure you know it, but lack of sleep, lack of quality sleep adds tremendously to weight gain. So there's huge correlations there. But I want to highlight the fact that the point that you made, which is so important, you were fearful of the unknowns, and yet somehow you became comfortable with living
mhm,
with these
mhm,
tremendously frightening, life
mhm,
threatening
mhm,
medical comorbidities.
mhm. Very
And
much so. Mhm,
I hope that people listening will share this with people who may be considering surgery,
mhm.
because I think you really put a good perspective on how scary both sides of the equation can be.
Absolutely, absolutely, and I mean, yes, having surgery anytime they put you to sleep, I mean, it's a scary thing. So you can't really, smooth over that. But with that being said, it wasn't as bad as I thought it was going to be. I mean, it just wasn't. But with that being said, the surgery and you have been phenomenal. I mean, you gave me great accolades, but you are just phenomenal, Connie. You just have no idea. And the mental aspect is what I say is so much bigger than the physical aspect. I mean, yeah, the doctor goes in and does his thing, but that's only the beginning.
It
So
is only the beginning.
it's the mental, and that's what the overcoming is. And
So we'll talk about that in 1 second, because of course I'm a fan of that mental part.
yeah.
But what made you decide I'm going to have the surgery?
I wasn't making progress. Um, I had dieted. I think I saw when you spoke with Olivia as far as the yo-yoing and going back and forth. Definitely that you get on it and you're doing great, but then you don't stay there. And I felt
Hmm.
like I was getting older and older, and I'm not getting better. And first I had the high blood pressure, and then I had, pre-diabetes, and then the sleep apnea. And it's like, it's not getting any better. So finally I was like, okay, I'm going to see about doing this. Now I had gone to a consult years before, and he gave me some crazy percentage of like survival. I mean,
Oh.
whatever he said, it was like there was a 10% chance, and whatever he said just spooked me. I was like, oh yeah, no.
Mm.
But in reality, and I don't know whether that figure was right or wrong, but in reality, I was sitting there in his office at that point with undiagnosed sleep apnea and with
Hmm.
other issues. So I had no telling what my percentage was anyway.
Right.
Um, so that I mean, just I'm able to look back at that now. At the time, I wasn't able to see that, but I think it's really important to say.
Absolutely. Yeah. What were your chances of survival without the surgery?
Correct.
Yeah. So which surgery did you have?
So I had the duodenal switch. Um, I had that was December 7th of last year. My highest weight, I was up to 389. Um, by the time I started seeking surgery, I was down to 360, and I kind of hovered around there. I walked into surgery at like 344, and I'm at like 225 now. So
Wow.
yeah,
Okay.
yeah.
Which is, I mean, you're so new,
Yes.
just at a year. I
Mhm.
can't imagine that the head games. I mean, not the head games, just the how difficult it is for your head to catch up with your body changes.
Mhm. It's it can't even be. I mean, I saw you all spoke. The clothes issue is a huge thing. Like just being able. I mean, it's over. Is the word you all hit on, you and Olivia on your previous guest, was overwhelming. It is absolutely overwhelming, because you go from your body doing one thing to doing something totally different. And so there's parts of it that you don't. You have to get adjusted to. There's parts of it that are happy, and there's parts of it that you're very apprehensive about because it's just new territory.
I'm
Um,
smiling because I'm thinking of something you did,
yes,
and if you say I don't want to talk about that,
no,
you go
that's
ahead and
fine.
say that. But you did something, one of the most fun things
Yes,
that I have seen a post-op do, and
yes,
this is about wardrobe.
yes,
Can you talk about that
yes.
fun photo shoot you did?
I did a photo shoot. It was for my 50th birthday. And I did my first ever photo shoot. And it was very over the top with my outfit, but I felt like it embraced everything that I was. It was very fun. And um, I was smiling, like real smiling, not fake smiling. And so those pictures will stay with me for a lifetime because there's so much behind those
Hmm.
pictures.
Yes, you looked glorious, just radiant from the inside out, and it showed.
Yes, yes. And one thing that has been a positive of this is that now I look at pictures and I actually like them. And before I would look at pictures and be like, oh, there I am. And oh, that's nice. But wouldn't really, but there's times now I'm taking pictures and I'm really like, oh, wow, I look pretty good. And
Ah,
so
that's beautiful.
yeah, that does help a whole lot, with everything. But it's really important, and I always say this is that I'm still the same person, and I
Hmm.
feel like it's so important to yes, that has been a change, but I'm not a different person.
Right. So you still have the character, you still have the qualities that made you you all along. It sounds like there's a level of what would the word be? Acceptance, or
Mhm,
not that you didn't accept yourself before, because those core qualities are the same. But
mhm,
when you look at those pictures, it's gone from meh to
mhm.
oh,
Yeah, absolutely. And I guess even with the way I felt, because I mean, this was tremendous. I got this done in December of last year. I turned 50 in June of this year, and so everything was just kind of fell into place. And I wanted it done before I was 50, and now I feel like, I mean, it's just crazy. I just really feel like I have a new lease on life because I don't have restrictions that I did before, and I can do things that I want to do, and just live. And I don't have, I've said this before, I don't have a goal weight that I'm trying to get to. I refuse to get caught up in that. I just absolutely refuse.
good. I
Um,
applaud you, and I want you to talk more about your refusal to have a goal weight.
Absolutely. But I, f- I go by the way I feel, and I feel better, and I'm getting up and moving around, and it's not a chore to do, and I'm running up and down my stairs, just doing different things, and I'm not dying in between, and so stuff like that, and I'm able to walk around in the trail or the neighborhood, just whatever I want to do, and I don't have anything saying, I don't feel like doing that. I'm by no means an Olympic champion, but compared to where I was to what
I
I'm
was
doing,
gonna say, you
yeah,
know what? Kind of you are.
yeah.
You're
So,
your own Olympic champion if
yeah,
you compare you to you.
yeah, absolutely. So that's been my biggest thing. So just for me, just feeling happy and just I think we did traveled one time and I would have, I didn't, we didn't end up doing it because the weather was bad, but we were going to do like the little outside train. I would have never thought about doing that because number one, I knew I wouldn't fit into it or there would have been awkward. But now I just, like, if I want to do it, I'll do it. If I don't, I don't. But I don't have anything telling me, no, you can't do it.
Right. Your weight is not prohibiting you
Correct.
from
Correct.
doing things you would enjoy doing.
Yeah.
So what are the reasons you choose not to, and again, I applaud you,
Yeah.
not have a goal weight?
I don't want to make that a focus for myself. I don't feel like there is a magic weight that I need to get to. I feel like I need to get healthy and I feel like I need to get happy. I mean, there's always going to be BMI charts and there's always going to be something saying you could be at a better. I mean, yes, we could always be at a better health. And I'm not saying that, but I have a new lease on life, even where I am being from, 220. And I know there's
Right.
people who are at my weight who are like, oh God, I mean, I'm at the worst weight ever. I don't feel that.
Hmm.
I'm at a really good place. I'm fitting into clothes that I would have never dreamed I would fit into.
What you're saying is so consistent with what I hear people say before surgery, but not often after surgery. So I love hearing you remain consistent, and I want to be healthier. I want to
Mhm,
be able to do things I want to do. I want to have a better quality of life. And so often, and so unfortunate to me, is that people get to a much healthier weight where those comorbidities are reduced or eliminated,
mhm,
and all of a sudden, they're all bummed out because they're not a certain weight, and it's devastating to me
mhm.
to hear that because it's like, well, I look
Yeah,
at you and you are living. You
yeah,
are out there doing your thing. And I'm guessing, and I want you
yeah.
to elaborate on this, that your outlook on 50 at this point versus your outlook on
Mhm,
50 when you were 49
mhm,
is
mhm.
very different.
Absolutely. I mean, I just, everything's so different with that. I mean, I don't feel like if I got to 150, for say, that would just make me I'm at a really good place. I mean, and I know I'm going to lose more weight and I'm fine and I have a great tool that, keeps me in check. I mean, from time to time. But with that being said, I don't I just I refuse to have that scale rule my life. I've
Good for
had that
you.
scale be scary. Every time you get on, it's like, and now I get on it, and and I'm still on the BMI charts, but I get on it, and I know where I was, and
Hmm.
I get on it with a total different feel about everything. So it just, it is. But I refuse to have that scale rule my life. I absolutely
Good.
refuse.
Good lesson, and I really hope everybody listening to that
Yeah,
hears that message. My
yeah.
gosh. So how is your blood pressure now?
So my blood pressure now, and it has been great. Now my cardiologist has frustrated me because you see all these stories, and you're like, "Oh, I immediately came off home a mess," and my cardiologist is weaning me off slowly. But she is a great. I will not speak bad. She is a wonderful, wonderful doctor, and I get it. I didn't get on all these medications overnight. I wasn't just taking one blood pressure medicine. Wasn't just
Right.
taking two. Wasn't taking three. I was taking five blood pressure medications. I'm down to four, and we're splitting one and a half. And so
Nice.
she's not doing it quickly, but I get it. It's a dangerous thing, and
Yeah.
um, it's been for because I wanted to walk in there and she'd be like, "Okay, great, we're gonna take you off." But I mean, the fact is that blood pressure can be more than just weight, and
Absolutely.
yeah, so I respect her for not just saying, "Okay, well, you're fixed," and so I'll continue, doing my regimen, and I'm checking in with her every 6 months, and
Beautiful.
she's weaning me off slowly, and it's going great. So,
And I respect you for letting her be the expert on that,
oh yeah.
and saying, absolutely.
Oh, she saved
Yes.
my life. I mean, my blood pressure just with doing, I was just sitting and it was, I would check it and it would be like 190 over like 150. And,
My
I
gosh.
was absolutely doing nothing. So yeah, she came in there and she got me. Yeah, I have trust in her and it's not, I didn't get on everything overnight, and my
Mm-hmm.
spouse helped me with that. Everything didn't happen. You just got blood pressure one day. No, you kept having to get med. So it's taking a minute to get off, and that's good. That's fine. I'm
Yeah.
good.
So your spouse,
Mhm.
supportive, going along. What have been the gifts in your relationship or the frustrations? Because we all know there's a lot of changes in relationships after surgery. So, you know, how's that been?
I've heard stories. I'm very blessed. My spouse has been nothing but supportive.
Beautiful.
She's been by my side from the beginning. She never told me to get the surgery. She said, if you feel like you need it, then you make that choice for you. She only told me she
It's
wanted me
beautiful.
healthier and that
I love
she
that.
wanted me to do what made me healthy. But she was scared of me getting the surgery as well.
Sure.
But she's been completely 100% supportive. I couldn't imagine doing it and not having her support and everything. I just couldn't imagine having done that. Because it's a huge, and I feel bad when I hear people saying they're not getting that support because as we spoke before, the mental aspect is so huge that to not have that support and to be going through the mental changes that you're going through, you need support. Whether it's from family, spouse, what have you, it's so important.
So let's talk a little bit more about those mental things. From your perspective and in your journey, what have the mental hurdles been?
Oh God. I will tell you when I first got the surgery, um, I felt like, and this is the best way I could explain it. I felt like a stalker who was given a restraining order. And
I love that.
I was like, I want to eat and I can't. And that was the best way to say it. I
Mhm.
felt like somebody had forced me to break up. I mean, it was a process. I mean, I felt like I was physically kept. You know how as a teenager, so you cannot see this person anymore. It was like that. Like
Yeah,
you cannot eat, and so you don't realize because your mind is like that smells good. I would like that, and
sure.
um it's not that it just doesn't work like that. My mother-in-law came once I was discharged from the hospital. She came to sit with me, um, and she stayed the whole day. And then that night, she made some chili.
Oh, geez.
And I already knew she makes a great chili anyway. And she made like chili cornbread. It was like this whole thing.
Oh
And
my
it
God.
smelled so good. And I mean, I couldn't. I mean, and even if I had wanted to, I couldn't have. I mean, I knew that, but it made me mad. Like,
Right.
I can't eat it. And you don't realize how much life, because if you would have asked me beforehand, how much does your life focus around food? I mean, like, not really that much.
Hmm.
But everything changed. My wife and I used to sit down for dinner and we would talk and eat and just go over our day.
Sure.
Now she's done and I'm still like picking on like it just
Yeah.
or either I'm sitting there and my stomach's hurting or I'm not enjoying my food or I mean
Hmm.
it's just and so everything does change. I have to make sure that I'm sitting in a correct position so my food can properly digest and that I'm,
Hmm.
eating the appropriate food and drinking and just everything. So it's not as easy as you get the surgery and get skinny and go on with your life. That's not what happens.
And wouldn't that be nice? But I'm so glad that you guys are all talking about the reality of this
Mhm.
because I think there are too many people who simply look at the befores and
Mhm.
afters and don't do any kind of research, and I can't imagine. I mean, you went in kind of knowing, but like you said, there's no way to really prepare for that.
Even with knowing and meeting with you beforehand was great, but you just until you go through it, you have no
Yes.
idea. You could have never told me you're about to break up with food, and I mean, I didn't want to. Like I said, I want to eat a bit. I mean, I don't want to eat cream soups. I don't want to eat
Yeah.
this. I want to eat regular. And I remember I mean, you just don't realize like little stuff, like you open the refrigerator and you might pop a couple grapes in your mouth, and while you're
Right.
browsing through something, did that. That was the biggest mistake I ever made. Like those were the worst two grapes in my life. And I was, and so I mean, you learn quickly. You learn quickly, but it's just everything's different. It's just
So that's what you meant by my tool will teach me a lesson now
oh,
and then.
it teaches you. I mean, I've eaten and taken one bite too many. It lets me know, and I think that's the important thing. It doesn't restrict you. It makes things for me more. It does restrict, but it doesn't make you to where you don't have to eat anything. I mean, for
Right.
me, and everybody's journey is different. Everybody chooses to go about things differently. It restricts me as I need to be restricted. It's made things less appealing, but I use it to my advantage, and
Yes.
I think that's the important thing. So even for now, and this is just me, and it's come to a year for this. If there's something I really want, I'm gonna
Mhm.
get it. I'm gonna eat it.
Mhm. Mhm.
But my tool does not allow me to just gorge on it, and it doesn't make it's not as good as it used to be. Whatever it is, it's just not as good. It's just, and that may change. It may change one day. I might eat it, it's like really great. But I think using it to my advantage and putting my protein in first. So
Ah,
if I eat something else, I've done
yep.
my protein, and so I don't really have the room for it. But yeah, I can take a bite of this or a bite of that, and and continue with my life. And it doesn't.
And I think that is so wise, and I really wanna highlight that point too. It's like, make sure you eat that protein
Hmm.
so that you've eaten that nice, dense food
Oh
that's
yeah.
gonna be good for your whole being, and then if
Hmm.
you want a couple of bites, do it.
Yeah, I mean, the
Right.
protein is important. If I focus on my protein, and then I'm good. I know I got protein and I got vitamins, and I need to do that, and that's fine.
Yes.
That's what I signed up for. I'll do my protein and vitamins, and if I see something and I want it, I might buy it. And then my stomach I might want it. See, here's the thing: I want it, but my stomach will be like, no, no, we don't want that, and it'll let me know real quick. So,
You said something a few minutes ago, and my mind keeps going to this. You said it's like a teenager who's
mhm.
in love, and they're not allowed to see the person they're in love with. Did you ever see the movie Dan in real life?
No,
Oh my
no,
gosh, I would recommend this movie
okay.
to anybody. It's such an adorable movie. Dan is played by the guy who plays Michael Scott. What's his name from The Office?
Yeah, Steve Carell.
Yes, Steve Carell, who I just adore. Anyway, he's a single father and he's got these three daughters, and they go for a vacation or Thanksgiving, or I don't know what I think it's Thanksgiving. And his daughter is in love. His teenage daughter is in love. And the boyfriend shows up because of course, they can't stand to be away from each other. They're in
Yeah.
love, right?
Mhm.
And Steve Carell makes him leave, and she's lying on the ground in her teenage angst, just screaming, "You are a murderer of love!"
Yes. Yes.
It's the cutest thing, but it's like this surgery is the parent here.
Yeah,
The
it
two
absolutely is.
parent saying, "You may want that all you want, but I know it's not going to be really good for you, and so you go ahead and try that and see what happens."
And that's exactly what it is. Go ahead and eat it, and then you'll know, and you'll be like, "Oh, yeah, okay." Yeah.
Ah,
Yeah, and it's funny because most of my issues that have come up with that, where my stomach's had to teach me a lesson, have been in social situations.
oh, perfect.
Because socially, you're eating and you're enjoying your people and talking, and it's a normal thing. And I feel like everybody's like, "Are you okay?" And so you want to kind of show that you're normal. No, I'm fine, perfectly fine, and like, no, and then it's okay, maybe I'll be right back. I'll be right in 5 minutes.
Yeah. Yep, you're paying attention to what that's teaching you, right?
Yeah, but I mean, that's one thing that I'm important, because I know the dual switch has a lot of elements to it. So
Right.
a lot was done, and prior to getting this, and when my surgeon suggested, I knew nothing about it.
Mhm.
I actually went to him to discuss getting the sleeve, And
Right.
he said, I think this would be more appropriate. And so I dived in and started doing my research. And
Good for you.
yeah, I'm happy that I did it, but it's a lot. But yeah.
Yes, there is a lot done in that procedure when
Yeah.
you mentioned the vitamins
Mhm.
and the protein. And I think that here's something that I think so many people unfortunately ignore. You are given what you need to know when you go through the
Mhm.
pre-surgery, and if you stay involved
Mhm.
with your program postoperatively, those vitamins are so dang critical, right? And some people are like, oh yeah,
Yeah,
well, whatever.
mm-mm.
No, 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 no.
No, those vitamin, and especially how much malabsorption that we have with this duodenal switch is so
Right.
important to get. And I couldn't imagine. You spoke about people, staying in with their surgery. I couldn't imagine having this surgery that is this life altering, and then walking away or not following up with what I'm supposed. I just can't imagine doing that. It's not magic. You literally have to do this stuff to keep this going because you
It
will not.
works if you work it. It
Yeah.
works if you work it, right?
I mean,
And so
vitamin deficiency is nothing to joke about. I mean, can you
not
imagine?
at all.
And
Illu-
protein deficient, I mean, any of that. So you have to be willing to, I mean, it's not magic. It's not. You
and
have to be willing to put in some work.
I'm going to brag about you too here for a minute because you show up at support groups.
Hmm.
You ask questions, you
Hmm.
share your experiences that help
Hmm.
other people. You are in therapy. You
Hmm.
are interacting with other people who've been through this process.
Hmm.
And there is there is nothing like having people who are on the same journey with you
Hmm.
to help you better understand yourself, help you feel better about what you're doing, give you the information you need. And then when you get to be the one to share that with others, what
Yeah.
an awesome experience.
Oh, your group has been absolutely phenomenal, Connie. I
Oh,
don't know
thanks.
if I could have gone through this without, I mean, when I say support, I mean, yes, you have the family support and that's great. But to, like you said, to be able to speak with people who are on varying parts of the journey. Some are just starting and stepping out. Some people have done it years ago and still maintain. I mean, I think it goes to show how life altering and how important it is. It's kind of like a flower. You just need to keep tending to it. Um,
Absolutely. What a great
yeah,
analogy.
because it's not going to magically just grow on its own. You have to keep just mess and with that being said, I mean, we've all had our mistakes and our tears and our why am I doing it, because we are the same person. It didn't change who we
Yes.
are. They didn't give me a lobotomy. I mean,
Exactly.
I'm still the exact same person. And I was raised in the South. I like sweet tea, biscuits, and gravy. None of that changed. Now, my stomach
Yep.
might not like it, but I still like it. And so
Mm, yeah.
I have to deal with that.
And it's really awesome in your situation because you've got a spouse who will listen to you and
Hmm.
talk with you, and you've got the other women in the
Hmm.
therapy group, which is a different level of comprehension and understanding. And you also go to your surgeon support group
Hmm.
where you get additional information. So when people say, "Yeah, it didn't work," it's like, "Yeah, the surgery works.
It's not
Maybe you
magic. I mean,
didn't."
it's just not magic. It's just, I think a
Yeah.
lot of people do go into it and think of it as like a cosmetic surgery. There nothing about my surgery was cosmetic. I don't know how it was labeled or anything, but this was an intense
Exactly.
surgery that redid all my inside. I mean, and yes, I'm going to follow up with my team. I mean, I trusted you with my life, and
Yes,
um, I want to
exactly.
make sure that I'm still okay. So yeah, I'm going to absolutely continue to follow up. I couldn't imagine.
And you, like Olivia, did a lot of things on your own accord. You didn't sit back and just assume 100% of everything was going to be covered
Yeah.
by your program. And they do a great job, most of the programs,
Hmm.
but a lot of them have once a month support groups, and
Hmm.
that's great, but not enough necessarily.
Right.
And in what research shows is that post-ops are asking for more post-op nutritional information and more post-op mental health help.
Hmm.
So you sought that out on your own. And so again, you should really be so proud of yourself.
Oh, absolutely. And it's, I mean, and Facebook has been a great tool in the fact that there's a lot of information out there. I would urge anyone to, do your research. And if your doctor is your doctor for a reason. So I go, when it comes to support and mental and, or have you gone through this? Yeah, I'll just turn to Facebook or something. But if it's a medical issue, I'm going to my
Right.
doctor. I want to hear from the doctor. Not some,
Exactly.
I mean, because all of us are different with everything and how this surgery affected me. Somebody else could have the same surgery and it not affect them the same way. I mean, we had different
That's right.
comorbidities going into it. We got obesity in different ways. We're different people. So my situation, I need my doctor to look at me and say,
That's right.
this is what you need to do.
And one of the things we've been talking about in the group is how one medication may affect
Hmm.
every single person differently. And so,
Hmm.
yes, you turn to your doctor for those kinds of things.
Absolutely.
So, if you were to sum up like the gifts for yourself and the gifts for your family, you and your spouse and your extended family, what would you say?
Oh man, I would say the biggest gift has been health and happiness, and they go hand in hand
They
because
do.
if your mental state has a lot to do with your physical state, and to get that inner happiness is huge. I felt like a lot of things in my life had gone wrong. I met my spouse and everything was great. I had met the best person possible. I mean, but the only thing I felt like that was hindering me was my weight. That was that one battle that I couldn't beat. I was like, nothing's ever kicked my ass like this weight has kicked my ass.
Right. Right.
And to be able to, get a handle on it. I mean, am I an Olympic runner? Am I a skinnier? I mean, but I'm smaller. It's not even about skinny. It's about smaller. And it's
No.
about healthy. I'm just not looking to. Again, I'm just not focusing on that part. But I can
Yeah.
walk up the stairs without being about it. I can go wash clothes without being. I didn't even. I was at the point.
Yes.
I didn't even want to walk around a grocery store. I mean,
Hmm.
I was not the person to go anywhere with because I was going to be complaining. I'm tired. My feet hurt. My back hurts. I don't want to be here. Let's go.
Sure.
And to
Yes.
just be able to go do stuff. I mean, it's just giving that peace. And my spouse has noticed it. She was like, "Yeah, you can do this now." And I'm not going into Sam's like, "Okay, we need to go. We need to go. Do we need to go down every aisle?" We probably still don't need to go
Yeah.
down every aisle, but it doesn't bother me in the same way. We're just going to spend more money, but but yeah.
It's so true. Health is wealth. Give me
Mhm.
health over money. Yeah, money's
Oh
great and
yeah.
all. You got to have it. But if you don't have your health, you don't have a chance,
You don't have
right?
anything, absolutely. And so just giving me that, just to even feel better and just to have choices. I mean,
Hmm.
just makes a huge difference for me. So if any gift, that's been the gift. It's been great. I can't say it hasn't been easy,
Right,
and there are going to be times, and somebody told me this who had surgery, not my exact surgery, but who had bariatric surgery.
right.
You are going to regret you did it, at least at one point. And it's true. And you was like, why did I
Hmm.
do this to myself? Why am I going through this? I've been through that. I've cried. I've gotten mad. I've done everything. But all in all, I wouldn't change having done it. I wish I would have had the balls to do it before, but I mean,
You do it when you're ready, right?
you
You
have to
do it
do it
when
when
you're
you're
ready.
ready. And
Yeah.
I had to be ready mentally, and I had to be willing to just give myself up and say, okay, I'm going to do this. And
Yeah.
I mean, I don't, a year later, I've had momentary regrets, like when I can't eat something or I'm hurling over
Sure.
the toilet or something, but
Right.
like, why
Right.
did I do this? But I mean, overall, I wouldn't change a thing.
I love your candor. I love your wisdom. I
Yeah.
love that are willing to share the real truth with people, and you do that. And you also are very vulnerable and are willing to ask the questions you need to ask. So, those are all things I would encourage anybody who's listening to your journey to take to heart and put into practice in their own lives.
Absolutely. Thank you so much. With like Connie, you have been instrumental.
Thank
You
you.
have no idea. You've been great.
You know, honestly, it's because not my journey wasn't, I've had a struggle with weight
Yeah,
and head thing, but I went to treatment for other addictions.
yeah,
And what I learned afterwards is what I knew this population needed somebody to help provide, because there are 1,000 people working in alcohol and drug
yeah.
recovery stuff, but not very many people in the world of bariatric surgery. So I am grateful to be able
I
to work with
found the
people like
best
you.
team between my doctor, you, everybody. I promise it couldn't have gone any better. I found the best
Well,
team. I'm so happy. I've got Dr. Proctor. He was absolutely phenomenal. You've been
he is
just
phenomenal.
the whole office. I just love it. I'm so glad. I would tell anybody this is the team, the dream
Yeah,
team.
you do have the team. I will agree with you.
Yeah.
All right, woman. Thank you so much. You know what would be fun is to have you back next year in December on
Okay.
your second year
Yes.
anniversary, and we'll talk about additional gifts.
Absolutely. Thank
All right. Thank you again, and
you.
happy holidays to you and your wife.
Happy
All
holidays to
right.
you, Connie. All right.
Bye.